r/ask Reddit. Doctors of Reddit. What's the stupidest patient you've ever had? I had to explain to a 17-year-old girl and her mother that she was not in fact allergic to alcohol, but she was just hungover. She complained that on nights when she drank too much vodka, usually on an empty stomach, that she would feel nauseous, flushed and sometimes vomit in the morning. But it didn't happen all the time, and there were no other typical symptoms of an allergic reaction. This one's my favorite so far. It hurts me incredibly though. I worked at a pain management clinic. In an attempt to combat opioid use addiction abuse, a lot of patients were prescribed a medicated cream. It looked a lot like sunscreen, and you just rubbed it onto the hurting areas. I watched the nurse carefully and slowly explain how to rub it onto the skin, using small and complicated words and going through the motions of applying it several times. But every so often, patients would complain that their cream tastes bad. So if I have a tummy ache, I can spread it on a toasted bagel and swallow it, right? I once had a child who swallowed a sizable magnet that passed to the intestine and we were just waiting for it to pass in stool. The next day when he came for follow-up we just found out that he swallowed another one that got stuck to the first magnet in the intestine through the stomach wall, resulting in intestinal obstruction, and he was transferred to or immediately to have them surgically removed. So you can eat as many magnets as you want as long as you wait for them to pass and be fine. But if you eat too close together you die without medical treatment. I had a mom and grandma bring their 12-year-old daughter/granddaughter to the emergency room because she was bleeding. Not from trauma or a wound, mind you. The poor girl had started menstruating and the mom didn't want to explain what was happening or started to happen, nor that it would continue to happen, as mom and grandma well knew. On the upside, it was a very quick visit once they were actually seen. Ugh, this is such a shitty thing to do. Firstly, it's completely unnecessary and a waste of medical professionals' time. And secondly, because it likely makes the poor girl feel like what's happening to her is abnormal. What a nice way to traumatize your daughter. Yup, I never got the talk. I'm 62. We didn't have health classes back in the Jurassic. Started at school. Thought I'd done something wrong. Kept going to the bathroom to check, after putting TP in my panties. Finally, my 5th grade teacher, a man, BTW, took me aside during recess and gently asked me why I kept asking to be excused. I told him I had blood in my panties. He noped out of the conversation and sent me to the school nurse, who called my mother to come pick me up, and for God's sake, what were you thinking? Tell her what's happening. Mother must have been slightly prepared, because after she brought me home, she handed me the Cotex sample pack and the book explaining what menstruation was. No talk, just read this. Once I did, I begged her not to tell my dad because I was so ashamed. Don't ask me about the training bra debacle in 6th grade. My dad is an orthopedic surgeon who does a lot of hips and knees and cries with laughter every time he tells the story of a woman who didn't understand how hip surgery works and thought they were going to take her leg off, fix the hip, and then reattach her leg. I blame Barbie dolls. I work in retina surgery. A solid 25% of people think this is how we fix their eye. Take it out, fix it, put it back in. Oh duck, if we're talking stupid ED visits. A woman came in because she got stung by a bee. Not allergic and no reaction. It just hurt. A woman brought her kid in because he got stung by a bee. Not allergic and no reaction. An entire family came in because they found a dead mouse in their apartment. Woman came in for a 2nd-degree burn on her arm. That was roughly the size of a Tic Tac. A woman spent like 5 minutes explaining to me that because of all the vaccinations we give dogs, we're seeing a rise in doggy autism. I like to call it portism. Had a patient come in stating that he couldn't bend his knee, asked him to remove his trousers so I could examine his leg. After he removed his trousers, the reason that he couldn't bend his knee was that he had a plaster cast around his knee. Checking his notes, he had been sent numerous letters asking him to come in for removal of this plaster cast, and as he hadn't attended any of the outpatient clinics, the hospital had assumed that he had removed the cast himself. No one can be this stupid, right? Paramedic. Got a call for a stroke. Patient had facial droop and slurred speech. Says that it feels just like the last time she had a stroke. 10 years ago. Says that the symptoms came on about 4 days ago and she knew the moment it was happening that it was a stroke, but didn't go to the hospital because she thought she could make it go away on her own. These stories make me chuckle. I'm also a paramedic and was called out for a stroke. Clearly the man was having a stroke. Upon doing a stroke screen it looked like the patient had something large in his mouth. Thinking maybe this guy had some sort of oropharyngeal cancer or mass, I asked his wife if this was indeed the case and she looked at me with a very puzzled look. She said no, and then I said, what is in his mouth? His wife then says it's a peanut butter and jelly sandwich that she shoved in there. When her husband's symptoms started she thought it was just that his blood glucose was low, so she tried to force feed this poor man an entire sandwich before she called 911. Our job security. There was a 24-year-old patient who was brought in from a jail in a rural county. He was working roadside cleanup when he found a bottle in a ditch that he thought contained alcohol and he quickly chugged it down. To be fair, it did look like whiskey. It wasn't. It turns out it was a substance that contained sulfuric acid. Its pH was less than 2.5. It just ate up the litmus paper. So shortly after he gets to the ICU he is in excruciating pain and vomiting blood. The gastroenterologist took him to do an EGD, basically a procedure where they can look at the esophagus, stomach and duodenum with a camera attached to a flexible tube. And the pictures were horrendous. You could literally see his stomach and esophageal mucosa eroding away. He had to be sent off to another hospital where they had an esophageal surgeon who could repair the mess. He of course needed multiple surgeries and had a very long hospital stay. I saw him a few months later when he was admitted for another issue. He was down to 90 pounds from about 150 and was getting fed through a peg tube. He was very lucky to be young and otherwise healthy, but obviously not very smart. My brother-in-law has a similar story. He is a pharmacist in a hospital. One patient got tar, I think, on his penis and in trying to get it off used something highly corrosive. He read the warning label to wear protective gloves and so he did before applying it directly to his penis. Edit to add. I don't remember all the details. It may have happened while working construction, while being an idiot. The only part of the story I remember clearly is where he read the label, put on gloves and then used the highly corrosive stuff on his penis. That level of stupid is hard to forget. Any chance you could be pregnant? No. So no unprotected sex with a man since the last day of your last menstrual period. Well, yeah, okay. I'm gonna have the nurse come in and give you a pamphlet. Then I'm gonna come back and ask you again. To clear some things up, as a medical professional we ask obvious questions and will be skeptical still. Because we have to. You have no idea how much patients, even doctors and nurses, lie or lie by omission, don't tell us everything because they don't think it is relevant. Sometimes even when you do everything right as a doctor in trying to come off as neutral, unjudgmental, and or even caring, patients will refuse to offer necessary information. Your situation has actually happened to a colleague of mine. But the woman was in fact pregnant because she slept with a man once in the last month but thought she couldn't be pregnant because 99.9999% of the sex she has is with other women. It was just one time. Too long, didn't read. We treat a lot of dishonest patients who ruin it for everybody. I know a guy who went to the doctor in a panic thinking he had cancer because when he tugged his eyebrow hair some came loose. Oh shit, I think I have cancer. That's double the stupid, because it isn't cancer itself that causes you to lose hair, but the treatment for it. I posted this a while back, but it's too good not to share again. 20-year-old girl and her fiance find out that she's pregnant. Me. Partway through taking her history. Do you smoke cigarettes? Her? Yay. About a pack a day. Me. You should definitely stop that. Her? Well, my sister told me that if I stopped smoking, the baby would go into withdrawal and die. Me. What? I work with pregnant women, and some care providers do advise slowly cutting back instead of quitting cold turkey. The sudden changes can in fact be a shock to the baby, but this doesn't mean someone expecting shouldn't be quitting unhealthy habits. There was a show in the UK called Misbehaving Mums to Be. The premise is quite self-explanatory, but there was a woman on there that smoked 10 cigs a day, but when she found out she was pregnant, started smoking 20. So when she's saying this to the midwife asks why. Explanation. I think smoking more will make the baby's lungs stronger because they'll build up an immunity to smoking. The fact that someone thought this woman was responsible enough to have sex with baffles me. A guy came to the outpatient clinic with swollen left ball. He said he was injected with some kajupa oil by his friend, with his consent, to enhance his performance in bed. I'm a female medical intern and I tried so hard to keep my expression as neutral as possible. He's got some big balls. No, just one big ball. Not a doctor but dental nurse. My favorite was a 30-something-year-old woman who came in for a checkup at the emergency low-cost clinic I worked at. Teeth were broken and almost black and gums are angry swollen. Bright red and bleeding by just moving her tongue against them. Needed multiple scaling hygienist appointments and a debridement. Honestly, YouTube has some amazingly disgusting videos of this treatment, but maybe keep the sound off if you don't like the scraping sound. X-ray showed she had all but her wisdom teeth and 10 fillings. Root canals to try and save some teeth and extractions for I think 3 but more if the RCT didn't work. Explained everything and did the usual explanation of proper oral hygiene. Asked her if she had any questions, to which she says, "It's okay if I lose this set of teeth. My others will come through." Me and the dentist just looked at each other probably a lot longer than we should have. No words. I couldn't think of anything to reply to that comment. I had a lot of weird and disgusting things happen at that clinic. I actually miss working there. When I was a child, my uncle told me if you live long enough you'll get a third set of teeth. It took me a long time to realize he meant dentures. A 20-year-old girl came in with abdominal pains. We did a pregnancy test and she was pregnant. She acted surprised because she was on the pill. I asked her how long she's been on it and if she had been taking it daily, as prescribed. As if it were the most logical thing on the planet, she said she did not take it daily because she did not have sex daily. I looked at her trying hard not to laugh. She only took them right after she had sex with her boyfriend. So like maybe a couple of times a week. Maybe the guy who had previously had an anaphylactic reaction to a foodstuff, but wasn't sure he was really allergic, so thought he'd test it out by bringing some to the ED waiting room and eating it. Spoiler, he was really allergic. I mean, if he's going to test it, he did so in the best possible place. As a doctor, I would give this patient 10 out of 10 for creativity. My one patient used to hold in her farts to the point of being in antagonizing pain because she thought that there was a certain amount of air inside a person, and if you let too much out you'll deflate. I could stand to deflate a little. I have a few examples. Patient who recently been diagnosed with diabetes. We needed to adjust her blood sugar levels but she kept eating sweets. So we had a talk for like 30 minutes with her about not eating sweets and so on. She seemed to understand. 5 minutes after the conversation she went around drinking a soda. Another guy who had a benign arrhythmia, the heart beats irregularly. He knew that he could get the arrhythmia from time to time, but as long as he didn't faint or got any pain in the chest he could just take a beta blocker and let it pass. But he went to the ER like 6-7 times before he understood that we couldn't do anything. One patient came in for something, can't remember what, and when we ran tests we found that he had a pH of 6.97. That is on the border of what the body can have and still have any function at all. Read. He should be dead. But he was awake and clear. We wanted to admit him to the ICU and adjust it with utmost care, but he needed to go home. To eat a shrimp sandwich. Yes, a shrimp sandwich. We sat down and talked to him and his mother for 30 minutes. That no shrimp sandwich in the world is worth your life. And if there is something else you need to get help with, we can help him. But nope. He left. He came back a couple of hours later and we cured his acidosis. But that must have been a mean shrimp sandwich. I wish someone loved me as much as that guy loved his shrimp sandwich. Dental student. I have a patient that claimed to have gone to medical school. Here are some gems from this patient. Patient. Hey doc, do I need to move my head medial or distal? Me. No. Move your head to the right. Patient. Do you remember the Matt Hasselbalch equation from organic chemistry? This is the old QB of the Seattle Seahawks. Patient, after looking at the X-ray or a radio pack, has density, mass in their mandible. Doc, this is malignant mass because I don't have the lymphadenopathy. Malignant means the bad cells can invade other areas, aka it's bad. The mass in the x-ray was a supernumerary tooth, aka extra tooth. It is within the spectrum of normal. Patient. Can you adjust my lingualized occlusion please? My mesiodistal cusps are fracturing. There is no such thing as lingualized occlusion. There are no mesiodistal cusps. Patient has severe bruxism. TLDR. Patient claims to have gone to medical school but uses phrases that would indicate otherwise. I was asked by a patient on the respiratory ward if I thought his lung cancer might have had anything to do with his 50-a-day smoking habit, because he smoked roll-ups and he wasn't sure if they counted. I struggled to keep a straight face and said yes and busied myself in his chart. I had a patient convinced that he was safe from asbestos cause he smoked a lot and it coats his lungs. I mems, you're right but you're wrong. Work in ED. Called the ambulance for chest pain. Was just upset her husband went to the tab. Gambling. Without her. Father-daughter combo. Convinced they had chickenpox. They had been outside fishing in the evening around mangroves and were eaten alive by sandflies. Came and hunched over in pain and crying. Claiming abdo pain. Didn't like the flavor of his meat pie and wanted it out of his body. The old sunburn trick and forgot to put it on and they suffer sunstroke. Drinking last night and expect us to cure their hangovers. Me. Any chance you're pregnant? PT. No. Me. Are you sexually active? PT. Yes. Me. Why is there no chance you're pregnant? PT. Because I'm not married. Me. Pee in this cup. I'm not active. I just lay there. Patient thought taking vitamin B6 double dose was the same as B12. Had a patient and his girlfriend complaining of fleas. They were covered in red spots that they were picking at constantly. They were meth heads that were picking their skin off and imagining bugs were crawling on them. They were adamant that they had seen these bugs and pulled them out of these sores. Discharge instructions. Stop doing meth. My mom did meth for several years when I was a kid and picked at my body along with hers. I didn't find out about the drugs until I was 17 and found her paraphernalia. But when I was around 10-11 she had me convinced enough to where I have memories of seeing them. As an adult much later I was talking to my dad about the bug infestation when I was in grade school and he explained the bugs weren't real. That was quite a shock realizing I had imagined memories. I had a patient on my OBGYN rotation who was in her 50s and decided that her clitoris was actually a growth and needed to be removed. She came in 3 different times to talk to different residents over a month and would never understand that she's always had it and it's supposed to be there. We even printed off a diagram of normal female anatomy to explain. Then she started saying her urethra was actually the growth and she wanted that removed. We explained she wouldn't be able to empty her bladder without it and she then demanded her bladder be taken out too. I think she should have been referred to psych. Not a doctor. Work an ultrasound. Patient. We have been trying to get pregnant for 5 years with no success. Me. Are you currently on any infertility drugs? Patient. No, but I have been on birth control for the last 7 years. Me. You are currently on birth control but also trying to get pregnant. Patient. Yes. I like to know when my period is coming. I'm not a doctor but got told to go introduce myself to a patient, get vitals, history, more info on their chief complaint, start an IV and draw blood for labs. They came in for arm pain and it looked like they had a nasty bug bite on their arm. So story was she is a stripper and their Adderall prescription wasn't doing the trick. So they had an idea how to make it more potent. They heard from a friend that if you crush it up, suspend it in water and inject it, it would be more effective. Except she used tap water to dissolve the Adderall before she injected it. This ended up causing a huge abscess and infection at the site of injection. She ended up losing her arm at the elbow, so now she's a one-armed stripper. 2 patients brought in a jar of water with string in it as proof they had worms. Meth, not even once. Had a married, elderly man lodge a marble pestle in his rectum because he was bored. His biggest concern was that his wife couldn't find out. Middle-aged guy lacerated his non-dominant hand with a reciprocating saw his dominant hand was using to cut PVC pipe under a sink. Diabetic woman said that she uses graham crackers and peanut butter to bring her blood sugar down. Yes, down. Morbidly obese young woman seeking evaluation for chronic knee pain while eating a meatball sandwich in the exam room. irate mom who wanted to speak to the doctor because we took an unauthorized urine pregnancy test on 16-year-old daughter just before x-rays. I never consented and now she's traumatized. Explained that it is standard in females of childbearing age and that consent to treatment was signed upon entrance to facility. Not good enough. They were rich Southeast Asian and I suspected that this routine standard was perceived as an insult to their status. I used to be a veterinary technician and I worked the emergency visits. One Sunday a woman brought in her dog in full panic mode because of vomiting diarrhea. Turns out she fed her dog Chinese food and spent $200 to be told not to do that anymore. I'm that patient. My dad is a doctor. As a kid I called him in a panic because I was peeing blood. Mind you, we were in Africa at that point and he was doing development work. Told me not to flush and rushed home. Just to clarify, my dad was in the middle of a meeting with a bunch of big kahunas from FAO, UNMSF and I ruined that instance for him. I'd eaten beets. Not a doc, but work at an I was putting in charges one night and one of the doctors had forgotten to mark the chart appropriately. So I looked at the diagnosis. It read imagined object in vagina. I went back to joke about this and got the story. A woman came in and said she'd accidentally sat on a cactus and had spines in her vagina. The doctor, with a female nurse in the room, had to go looking and never found a single thing, including any wounds or signs of irritation. When I asked why someone would do that, sarcastically, the doctor on at the time said, well, I guess if you've got nothing better to do on a Friday night. Not a doctor, but when I was in college this girl, white, I was dating called me all freaked out that her skin was turning black. This was midday during the week. She said she was going to the hospital. My house was across the street from the university hospital, so I decided to head over to see what was up. She was distraught. I went into the examination room with her and she explained her situation to the doctor and showed him her arm. The doctor just licked his thumb and rubbed her arm. Turns out she was wearing a brand new black sweater and some of the fibers rubbed off on her arms. In my country, heroin addicts who cannot follow a methadone treatment failed other attempts at getting away from it can be prescribed heroin. They get it in a controlled environment with clean needles together with psychotherapy, social services, treatment for other stuff they often have. It is called heroin supported treatment. Has been pretty successful in crime reduction and improvement of health of severely addicted people. Friend of mine is a gynecologist and she told me that once she had a patient come in and tell her that she cannot have sex anymore because her partners complain that her hoo-ha stinks really badly, but she's never noticed. So doc asks questions like, have you been using any new soaps? Creams? Are you allergic to anything? And the patient said no. Doc examines patient's vag and the smell is unbearable. She suspects a major infection. Then she realizes that she cannot see inside properly, and she grabs her tweezers, IDK the proper name, and prods. She hits something cushiony. She starts to pull gently and extracts a tampon. A month-old tampon which was black and green and smelt foul. Patient says, oh, I thought it has fallen out when I had my last period. Not a doctor, but I work in a pharmacy and the first person that came to mind was a very overweight lady with an absolutely toxic personality. She always treated whoever was with her terribly. Would come in every few months with a new ad from Dr. Oz for a new product to help her lose weight that she made me place a special order for. Know what? She never shed any pounds. Paramedic here. Called for a diabetic. I get there and the patient is an older gentleman who is laying on a bed with what looks like a white mask on. I ask what's going on, and the family goes on to explain that he's a diabetic and the doc told them to give him frosting if his sugar gets low because the sugar content will perk him up. Turns out he didn't explain that they should put it in his mouth. That's right, they put a white frosting mask on this poor guy. Shocker, it didn't work. My wife is an RN who works at an outpatient surgery center. Cataract surgery is one of the common surgeries that they do. Patients are told that after the surgery, they should put eye drops in 4 times a day for 1 week. So 28 drops altogether. One patient asked if it would be okay to just put the 28 drops in all at once so they didn't have to deal with it for a week. Respiratory therapist here. Was working and was told we were getting a patient in respiratory distress. When she gets in, she is having problems breathing and need oxygen. I'm placing an oxygen mask on her and she yells, I'm allergic to oxygen. I heard the doctor laugh behind the curtains. I'm a psychiatrist and the shit I've seen is ridiculous. PT offering blowjobs for promises of crack cocaine from other patients. Kept getting interrupted by nurses while she was attempting. Found out she was HIV positive 2 days later. Bipolar guy admitted for mania. Later discharged to jail for having raped his 2 nieces. Kicker was his ex-GF happened to be admitted to the same psych ward for SCZ. And tried beating him up for cheating on her by raping his nieces. Dozens of points come to the psych ward and pretend they're suicidal or homicidal in order to get a hospital bed for a day or 2. As soon as they are cured. PT who literally faked a name, Australian accent, badly, and backstory 3 days until one of the other doctors recognized him and called him out for it. Immediately wanted to be discharged. Not stupid, but funny. PT who jerked off and actually ejaculated during court, which was to declare him incompetent and requiring involuntary psychiatric admission. Judge obviously ruled in the doctor's favor. I had a fella come into the ER who was stone sober, but only because he had spilled all of his rubbing alcohol onto his pants, which meant he couldn't drink it. The reason why he was in the ER in the first place was because he tried to burn the alcohol off of his jeans by lighting the alcohol on fire, thinking the alcohol would burn and not his pants. He had some pretty rowdy burns from the calves down because he couldn't get his pants off of his shoes. To be honest, pretty nice guy. Absolutely the kind you'd expect to light themself on fire, but he was very pleasant considering the circumstances. We had a young methamphetamine addict present with upper abdominal pain. She had a gastroscopy and deteriorated afterwards. CT showed she had a perforated stomach following the procedure, the worst possible complication, and would need emergency surgery. Despite the damage, she was not clinically too unwell yet. Despite hours of counseling pleading, she self-discharged later that day to go home and smoke meth. Never heard about her again. Whoa, you made it to the end? You're a ducking beast. I'll cut you a deal. Smash like and subscribe for more curated content, bruh. It's free and that's a great price.